Hello students, welcome to your Module 3 client status quick PowerPoint and instructional video from us W30CC instructors. Again, you'll do most of your work over there on Healthcenter 21, so please make sure you log into there and complete your work. However, this is just an overview of stuff that we think is important. We'll also be going over a lot of this in lab again, so don't feel overwhelmed in knowing it. We want you to pass all your quizzes and tests, of course, in Healthcenter, but we'll reinforce it before you have to do the checkoffs for vitals in the lab. So, client status mainly encompasses, if you notice, click over here. Client status is your vital signs module and body measurements, your temperature, pulse, respiration, and blood pressure, and then, of course, you'll have your module test. The whole unit is 760 points. So again, to figure out your grade for that module, you'll take your points that you earn, divide it by that total number, and then move it with the decimal 2 spots to get your percent. Again, we don't round up, so make sure you make note of that. All the tests, all the module tests right here, have to add up to a 75% or better to pass the class, and all the other work needs to add up to a 75% or better in class. So just keep that in mind. So vital signs. Why is vital signs important? Well, we use it for numerous reasons. It tells us the basic body functions of what's going on in anyone's body. So we want to know how their heart's doing. Of course, we're going to take their blood pressure and pulse. We want to know maybe if they have a cold, we're going to take their temperature. So all the vital signs show us as a nurse or the doctor or whoever is evaluating what's going on, even a pain. If the patient's having pain, we'll see elevated signs in their vital signs. So we want to know exactly what's going on in those vital signs. So point number 2, taking care of people. We want to know, are they sick? Maybe they're having a heart attack. Are they not breathing? Simple things like that. It could also mean as a nurse, we're giving lots of medications that could lower their blood pressure or increase their blood pressure. So we want to know what their blood pressure is before we give that. Also, maybe we're giving a pulse medication, so we want to know what their pulse is. Oxygen. If they don't need oxygen because of their O2 sats different, then we're not going to apply oxygen. Again, all these medications, even oxygen is a medication. So that is according to the nurse. Always work within your scope as a CNA. You're taking the vital signs, reporting abnormals and normals to the nurse, and which is taking that information and doing whatever they need to do with that. Also, the last point I like to make is a lot of insurance, and especially Medicare now, they pay according to what's been going on with that patient during their stay. So if they're staying in a long-term care facility and vitals aren't done, it could be. I'm not saying it is a reason why they wouldn't pay for that day, but it could be a reason why they deny payment for that day. So we always need to make sure things are done and charted as well. Because if it's not charted, it was never done. Even if you wasted all your time doing it that morning, and you got busy and you forgot, then it wasn't done. Okay, and a lot of charting now, of course, is electronic, and some electronic software won't let you to backtrack. Some will, some won't. So just know what facility software you have and what that encompasses. So vital signs, what they include: your blood pressure, your pulse, your respiration, temperature, and sometimes depending on where you work and what shift you work, you might also be getting your oxygen saturation, abbreviated O2 sat or O2, and you might be grabbing a pain level, and that's just usually where on a scale of 1 to 10. Okay. So let's just go over blood pressure real quick. Again, we're going to be doing this in lab again. So what is blood pressure? Well, it is the pressure inside your body. It's telling us what your heart is doing when the blood is initially pumped through your body and then when it returns to your heart. So it's telling us the pressure inside your arteries and veins, okay? In lab, we will watch this quick little video, and it will explain more. Blood pressure is measured by 2 numbers. One's a systolic and one's a diastolic, wrote in a fraction form. So the top number is usually bigger than the bottom number, okay? And diastolic is on the down side of that fraction. So diastolic down, systolic is on top. In the video, it'll kind of tell you a little bit of why we call it systolic and diastolic. At this time, I only have a certain amount of time to do these videos, so I can't go into depth with that. But just keep in mind we'll go over it more. So, normal adult range, there is different ranges depending on if you're adult, child, and infant, so on and so forth. So, know those. But normal adult range is 80 to 120 for the systolic and 60 to 80 on the diastolic. If you see a hypotension, hypo is low, hyper, because you're hyper, and that's how I remember it. I'm just giving you guys little tidbits. Hypertension is high blood pressure. One way I like to visualize what's going on inside your body is think of a kinked hose. See this guy who's standing on the hose? Well, he's standing on it, and when he gets off of that and then releases it, the pressure is going to be higher when he releases. Okay, so that's why his systolic is going to be higher, and then when it returns to an even flow, it goes back. So you like to see a 170 over a 90 on that. Again, that's the same principle inside us. See the clog right here? That's like, pretend like his foot stepping on that. It's causing that clog. Okay? So same idea. For the low blood pressure, or if we're bleeding out, or maybe we're not having a high blood pressure inside our body, there could be different reasons why. I just want to show you the relationship between hose and in our body. So again, if we poked a bunch of holes inside our hose, our pressure is going to be lower because we're losing pressure. Same with our body. If we had a cut and we were bleeding out somewhere, then that's going to cause our pressure to be lower. Okay? And this just shows you a quick overview of what high blood pressure does to our body. Okay, and we'll go over that a little bit more in lab. This is just the parts of a blood pressure cuff and a stethoscope. Okay, I'm going to quickly, this is the pump right here. So you pump it. Right there on the pump right above is the valve that opens and loosens it so the air is slowly released from the cuff. Okay, there's the dial where we actually get the numbers for our blood pressure. Here's our stethoscope with our earpieces, and then our tubing, and it goes down to the bell of the stethoscope. In this picture over here, the bell actually rotates, so you can listen to the kids' blood pressure on the small side. Also, we use the small side for lots of lower sounds, and you can hear better. The ear tip should always be pointing towards your nose. Okay, and let me click on this next one. Pointed towards your nose, so it's in your ear canal and not pointing backwards to the back of your ear. You'll just hear things better. Okay, earpieces should be pushed all the way in your ear. Make sure your bell is on the correct side. Tap it just to make sure. Make sure your bell is on the correct spot, which is over your brachial site. Oops. Sorry. Go that far. Okay. Make sure your cuff is on the right side. Shirt is tightly against the arm or pulled up. And make sure you're watching or listening for your blood pressure sounds and not watching the needle. Okay? The beginning steps in blood pressure is wash your hands, knock, then provide privacy, introduce yourself, explain procedure. Okay? Clean the stethoscope, expose the arm, feel for the brachial artery, make sure your arm is upwards again, and okay, and this shows you where the brachial artery is, one right there on that arm, this spot on that one. Here's another overview of that. Then you're feeling for the brachial artery, putting that on, then placing the diaphragm bell of the stethoscope on that spot. Place your earpieces in your ear, pump it up, 160, 180. Slowly let that out, and then the first sound you hear, right here, the sound's heard, your artery is opening and closing right there. That's your systolic, and the last sound you hear is actually the diastolic, okay, and that's where you get your numbers. Then, slowly deflate, that goes over what we just said. You're listening again, first sound, second, or last sound. So, you're going to hear thump, 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 and then nothing, silence, okay? And that last sound before the silence is your diastolic. This is a great little picture and video to quickly refer back to, okay? Know your parameters, don't guess, and don't watch your needle. Lastly, remove your cuff, put your call light in reach, wash hands, and chart. And that just goes over the steps. Pulse, make sure you know the different sites to get a pulse. You count for 60 seconds. There's all your pulse sites. I have to speed along because I only have a few more minutes with this video. But there's all your pulse sites. You should know where to get those. Radial site is what you're going to be tested in your tests for. That's on your thumb side. Brachial's on your pinky side. So you use your two fingers and feel right between that radial artery, right there on the radial artery. Not using your thumb, your first two fingers are can feel it easier. So make sure you use those fingers. Explain to your patient what you're doing. Introduce yourself. Provide privacy. Place fingertips on the thumb side of the client's wrist to locate your radial pulse. Count for a full minute. When done, call light and reach, wash hands, and then record. Respiration is a whole cycle. It's one in and one out, so that's one cycle. You count again for another minute. If you say the person's a shallow breather, put your hand on their chest or their shoulders, and your hand will actually go up every time they breathe. And this is what the inspiration and expiration looks like. Okay? Again, that is a whole cycle. The procedures: explain to the client what you're doing, introduce yourself, provide privacy, start counting using your watch, time it 60 seconds, 1, 2, and every time they breathe, counting in your head. Okay? At the end of your 60 seconds, call light in place, wash hands, and record what you got. Temperature. This is not a board skill, a skill that you will do for the boards, but it's going to be something you're going to do any other part of work, where you work, you're going to see it. So tons of different places where you can get a temperature. Oral, rectal, axillary, under your arms, temporal, tympanic, and then the forehead scanners, behind the ears, and I just put up some slide pictures of what you'll see. This right here is just showing you if it's a hypothermia, too low. So if it's in the hypothermia range, you're rechecking that, okay? We always want them to be at least above 96, okay? So if you drop below that, please make sure you're rechecking. Hyperthermia, again, you're rechecking also, just to be sure. And that's usually around, if they're higher than 100, we're thinking of a hyper or pyrexia temperature, okay? These are some more sites. There's now even apps that you can get have your phone or a smart device be a thermometer. This one you don't even put on the head. If you notice, it's just scanning the temperature. Behind the ear, an axillary, which you will be doing a lot on children. And there's even a binky or pacifier that you can buy to do that. The skill itself is address your client by name, introduce yourself, know what thermometer you have, avoid fiddling with the equipment. Okay, your tympanic, you're going to just pull the ear up and back for an adult and down and forward for a child. And that's opening that ear canal so we can actually get that tip right here, this tip inside that ear canal, if you can tell. Click scan, look at results, discard, wash hands, and then record. You're always recording the results going after your pen after your hands are clean. If it's an oral, it's a blue thermometer. If you look, there's a blue and a red. The red is for rectal, blue is for oral. So just think of them drinking water, it's going to be blue. Turn on the device, put on the protective cover, insert it into the buccal cavity, which is right underneath the tongue, okay, in the heat pockets, if you look. There's another picture right to the side. Wait for it to beep, remove, look at results. Remove and cover, dispose of the protective cover in the garbage can, wash hands, and then record. If you're doing a rectal temp, again, you'll see this with if you work in OB or unit or in a pediatric. We don't do a lot on adults, really rarely, maybe if they're on hospice or something, we need that accurate one. But place the patient in a position. If you notice there's a baby in this laying down position, you can also put their legs up on the head or put it in the Sims position on the side. Turn on device, place protective cover and lubrication on the tip of the device. Insert into the rectum. Please do ever, 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 ever let go of your thermometer because your sphincter will pull that in. Hold like this in the picture with your two fingers, holding that. Okay? Wait for it to beep, wash hands, record results. If you want to already start working on these vital signs, we will give you you will bring this paper during lab and finish 20 vital signs in lab. You can start earlier, it'll just make sure that you know what you're doing. and good luck. Have a great day.